and all that.
Claire Goodwin-Fee is a psychotherapist and founder of Frontline 19, which is an emotional support service for NHS frontline workers. And I'm delighted to say she joins me now. Good morning to you, Claire.
Morning.
Morning. Well, what do you make of NHS England stopping its mental health support for clinicians at this stage?
I'd like to say that I'm surprised, but I'm not. I mean, I'm shocked by it. I think it's a very poor decision. Just a bit of background, I started what I thought was going to be a very small project at the very start of COVID to help out, like a lot of people did in lots of different ways, to offer some support to frontline NHS and frontline workers during the pandemic, because I knew that they would be under a lot of pressure and they would see a lot of things that would be incredibly difficult. I totally underestimated, even with my background knowledge, the emotional need for mental health support across the board. And so, I started off thinking maybe we could help 40 or 50 people, and now we work with about 9,000 people a week.
Jeepers, sorry. Well,
right.
You expected 40 and you work with 9,000?
In the first day, I set up a very, very small Facebook page and pressed the button and kind of said, look, because my dad had been in intensive care, I trained in the NHS way back in the day, and I thought, look, if you can do something to help, like a lot of people did. And I just thought this might be a bit more helpful than cooking. I can cook, but maybe not on the kind of scale that people needed. So pressed the button. The first day alone, 750 people came through and said, we desperately need help. And we helped all sorts of different people, teachers, And then all of a sudden we had this massive wave of NHS staff, paramedics, ambulance techs, nurses, intensive, you name it, across the board. It was a huge wave of need. And, we rode it and we did our best. And as I say, now we work with around about 9,000 people a week. And we've just launched a campaign called Sicker Than the Patients, because often the workers are struggling so much more. Because think of this, and I ask anybody that kind of goes, oh, is the job that bad? No, people love their jobs. But you're standing waiting to cross the street and you see a blue light, and you look up, and I often think, gosh, someone's having a bad day. Yeah. Someone might have had a heart attack. Can you imagine if that's your shift? And it's hour after hour.
This is kind of brings us to the critical aspect of this debate, which is whether or not the service you offer and other people may offer to clinicians should continue when the worst horrors of COVID, I'd like to think, are behind us.
It's not just about that. You see, that was my mistake. I mean, and you'd think I'd know because I was from the public sector originally, and my parents were both public sector workers. It's not just about that. It's about baby death. It's about nearly 57% of paramedics in the last 12 months have been physically or sexually abused by patients, and that's without all the verbal abuse that goes with it. That's about walking into somewhere where someone's taken their own life, and you then have to go home and kind of pretend that nothing's happened with the rest of your family. And as I say, within a shift, you might see 5, 6, 7 different types of trauma. Yeah. And over a period of time, we are all human beings. It is only right that has an impact, because if we didn't have any kind of impact from that, we'd be robots. So do I think the services should continue? Absolutely. And I'm devastated for NHS.
Should doctors be able to jump the queue, which I thought was a really interesting line from Roy Lilly?
I'm probably biased, but yes, I do think they should. If you look at the work that they do, it's not. I'm not saying anybody's more important than anybody else, but unfortunately, if decisions have to be made personally, I would support them jumping the queue, because if you look at the cost of the sickness records and the amount of people going sick in the NHS at the moment, it's horrific. When you've got 1 in 4 clinicians who have considered taking their own life.
1 in 4? I didn't realise it was as high.
When you look at the stats, it is a mind. But I would urge anybody, please have a look. Just Google Sicker Than the Patients. A lot of the stats and stuff are on there. We talk about it. And the film that we had an amazing advertising people that helped us with it, Adam and Eve. They did it all for free, and it showcases what a worker goes through and how difficult this is.
Claire, I've got to wrap it up, because one, I want to have a quick look at that website, and also to say thank you to you and to Roy, who was hanging on the phone listening to all of that, for helping set out the stall. Claire's made an amazing case. If you've got 1 in 4 doctors or clinicians considering suicide, then why is NHS England axing its mental health support, specific mental health support for NHS workers, and sending them down the same corridor the rest of us have to use, the corridor of uncertainty?